Welcome to Oli Health, the AI-first, all-in-one EHR and practice management system, built specifically for allied health professionals. Everything your practice does, finally connected in one place. Every patient relationship starts with a form, so let's make yours effortless to build and to fill out. All right, let's set up intake and consent forms in Oli. We'll head into Templates, and right alongside My and Practice Templates, you'll find the Consent and Intake Forms tab. These are the forms that go out to a patient before they're even created in your system. Or, for an intake tied to a specific visit, you can send it ahead of every appointment. How they're delivered is handled in Settings, under Patient Forms, and Scheduling Configuration. That's a whole topic on its own. So today, let's stay focused on building the forms. And here's the best part. You don't have to start from a blank page. Oli has a whole library of ready-made forms. So let's open Browse Community and see what we can find. Inside the Community library, we can filter by type. Let's set it to Forms. That leaves just the Consent and Intake forms and hides the chart note templates. From here, you can search by title or browse by specialty. Search the library, and you'll see every intake form available to you. Look for your specialty or pick a solid general one. Let's go with something comprehensive. This naturopathic intake questionnaire looks perfect. Let's open it up. Before you commit, you can preview any template. Just scroll through and get a feel for the sections and the questions. Like what you see, click Use this template. Oli pulls it into your account. If you're already signed in, you land right in it. If not, it'll have you log in first, then import it into your Forms library. We'll hit Import, and there it is, landing right at the top of your library, the ND Intake Questionnaire. Notice it's flagged as a draft with an Unpublished Changes badge. That just means it isn't live yet. Patients can't receive it until you publish. So read it through, make sure every detail is right. Then hit Publish, and it's ready for your patients to fill out. Up at the top, you pick what this form is, consent or intake. The difference is simple. A consent form captures a signature, an intake form doesn't. Everything else about building the two is exactly the same. Over in this corner, you've got two modes, Editor and Preview. Preview is what your patient sees, the form exactly as it'll be rendered to them. And it's fully live. You can fill it in yourself and see exactly how it behaves. Submit a test response if you like, then just flip back to the editor. The editor is where you shape every part of the form, block by block. And it's already full of examples we can learn from. There's a long answer question and a 1 to 10 rating scale. Below that, checkboxes, radio buttons, multiple choice. There's really a field type for anything you'd want to ask a patient. Now this one's an intake form, but watch what turns it into a consent form, a signature block. Drop in a signature, and Oli captures the patient's sign-off right on the form. Open its settings, and you can add help text or choose who's allowed to sign. There's a typed fallback, too, so they can type their name instead of drawing it. And an attestation line, the wording that makes that signature legally binding. It's not only the signature, though. Every block carries its own settings. Open any field to fine-tune it, and mark it required, or leave it optional. And that, honestly, is all there is to building a form. Ours is ready, so let's lock it in and publish it. Oli asks us to confirm, and that's it, the form's published in live. Now let's start a fresh one from scratch, to see the editor completely empty. Here's a new intake form, nothing in it yet, and the preview's just as empty. Worth knowing, once it's published, you can't switch a form between consent and intake. Need the other type? You just build a new one, quick and painless. So on a blank form, how do you add a question? You reach for the /. Type a /, the field menu opens, and we'll start with a short text. Every question gets a header, so we'll call this one first name. The line just below is where your patient types the answer. We'll mark it required, so it can't be left blank. And in its settings, help text, a placeholder, even a default value. Plus a custom validation message for when an answer doesn't look right. That same fine control sits behind every field you add. Now let's add a long text field and label it reason for visit. That one captures the longer answers, plenty of room to write in their own words. And there's plenty more in the menu: number, date, and time fields. A yes or no, a drop-down, multiple choice, and checkbox groups. Sliders and rating scales, 1 to 5 or 1 to 10. Patients can even upload a photo or a PDF or add a signature. And then the real standouts, the clinical blocks. These build a validated screener right into your form. Say you want a pre-visit PHQ-9, the depression screener, drop it right in. And just like that, the whole 9-question screener is built right into your form. And every answer flows straight into the patient's overview, charted over time. That's one of about 50 measures Oli can track for you, visit to visit. Looks good, so let's publish it. Oli saves it live as version 2. There it is, at the top of your list. From there, it goes out to any patient. That's forms in Oli. From a blank page to a polished, signed form, and everything you capture flows into the rest of Oli. Welcome to the future of your practice. Welcome to Oli Health.